Hello, Yasir. Welcome to CERP Podcasts. You recently conducted a study on frontline health workers and on motivating them for improved service delivery in local communities. In light of this research, how do you think public service delivery, especially in healthcare, can be improved through policy?
I did a study with the community health workers, which are called the lady health workers in Pakistan. And but based on the results in the study, I think we have a very clear indication that community health workers can be motivated without using any financial incentives or other perks. The general widespread kind of understanding is that to get workers, especially public sector workers, to improve performance on their job, you have to provide them either financial incentives or give them career opportunities or posting opportunities so that they feel motivated to exert effort on their job. But what my research shows is that even if you do not provide them those incentives, which are resource intensive in some ways, require from the organization or the government to have money, you can still motivate them. And one specifically in my research, I show that if the communication from their managers about the organizational mission is one of the key ways in which the workers can be motivated. So the idea here is basically when workers, especially public sector workers in Pakistan and many other countries, they work in bureaucratic organizations where there may not be that much focus on the larger mission of the organization. What I show is that when the organization and managers communicate to workers that here is the organizational mission and this is what we really care about, workers take that as a signal that this is something that we should really focus on, and they improve their performance on the job. Now, I also kind of study and test how financial incentives work or financial incentives behave in a similar kind of environment, in a similar environment. And what I find is that since these community health workers are required to perform multiple tasks, so it's not like a factory in which a worker has to make a stitch. It's kind of a place where the worker has to make a stitch on a button, but also kind of probably put on a collar on a shirt and put on a sleeves, which is what we call a multitasking in a job. These workers are required to perform multiple tasks for their job. In these settings, providing financial incentive can backfire or at best is limited. And it's limited in a sense that you can only provide financial incentive based on certain tasks. That means workers will focus their attention to only those tasks that gives them money in return and may ignore the other tasks. Whereas what we find here is that if you motivate workers through their intrinsic motivation through the mission, the workers improve performance along multiple tasks. So they exert effort on all tasks, those that could be incentivized and those that could not be incentivized as well. So what really I find here is that basically to improve the performance of health workers, the government has to focus on trying to get them motivated, trying to get them what we call intrinsically motivated. And one of the ways in which they can be intrinsically motivated is if the organization and their managers constantly keep a focus on reminding them that what their broader mission is. And that provides them kind of a cheaper way to get the workers to improve their performance without giving them explicit financial incentives.
Right. And what would you say are the barriers that are preventing the healthcare system to galvanize these workers so far?
So one of the biggest barrier to galvanizing these workers is that the government uses them as a tool to basically address any problem that they face. So even though they are health workers, they perform duties as diverse as census, taking account of people in Pakistan. They are also put in to basically take care of some election duties. They in dengue season they are also dengue monitors. So what we really see here is a situation that these workers are given these tasks on ad hoc basis as and when the government is facing a problem. which means that there is a mission creep. These workers do not really then focus on and do not really have time to think of their core duties, which is basically preventive healthcare of focusing on mother and child. So in order to galvanize them, the government has to really think about how to not give them these additional duties on top of a large number of duties that they are already responsible for. And what really happens is that when you pull a worker out from the community and stop them from performing their duties on basic healthcare and ask them to go perform an election duty or to go perform a census duty, you are not only taking the time that they would have spent on their community health working kind of job, but also what you are doing is signaling to the worker that, oh, your bosses and your department actually doesn't really care about the mission that much, because if they did, then they would have not disturbed your flow of work. Instead, they care about whatever they tell you they care about, which is at that particular time they tell you that, okay, your core duties are not important, your other duties are important. So the workers then kind of become relaxed about their core duties, and that kind of leads to larger problem of shirking and not performing their duties.
Right. And how do you think that we can prepare for the current and potential challenges to the healthcare system in Pakistan resulting from the pandemic?
So the pandemic has basically thrown a lot of health systems into disarray, and ours is an especially weaker system, primarily because we have a large rural population, whereas most of our health system is kind of concentrated in urban areas, and even within urban areas, it's concentrated in these large cities that have large teaching hospitals, tertiary hospitals. But kind of what we do have the benefit of is having these community health workers called the lady health workers spread all over Pakistan, especially in rural areas. I think in the country we have about 140,000 of them, which provide us access to the communities in rural settings where there may not be a proper health clinic or hospital or a basic health unit. So what we really need to identify is that how to get these workers galvanized to make sure that they provide kind of the first wall of defense against the spread of pandemic. And that's where, again, the motivation of these workers come in. It's an inherently risky job because stopping a pandemic means that you are getting your workers exposed to the possibility that they will get infected. And only the very motivated workers would really like to put themselves up in front and go out and try to stop the pandemic through communication with the communities about preventive measures, through screening and through surveillance. The main idea here is that how do managers in these health systems and the health system at large try to focus on motivating these workers. My research shows that keeping the mission central to the working of the organization can really kind of show that this is one can really help the organization get the workers motivated. Now, in addition, we've seen that basically governments in Pakistan, provincial governments, have also tried to kind of like have grasp on this. So we have also found that provincial health departments in Pakistan kind of understand this somewhat. A key example is given by the KP government, where the health minister and the health department during the pandemic, we saw that they were at the forefront of trying to be innovative with how to get the workers motivated. They were recording messages for the workers, going to the hospitals and their workstations to thank them, making songs about them. So all of it basically boils down to getting the workers be motivated about doing their job, because at the end of the day, we cannot provide them enough financial incentives to go out and put their lives at risk.